Hi, my name is Daniel. I would like to talk about the COVID-19 pandemic and why people tend to downplay its impact to health, business, and geopolitics. My hope is for people to take this matter very seriously and follow safety protocols more stringently. From surveys that I have read, almost 60% of people think the virus poses a low threat. It indicates that the COVID-19 pandemic is seen only as a very high threat to the world from an economic standpoint, more than from a health perspective. This perception, by no means, could be valid, as statistics would show the following. Testing outcomes are 91.5% negative and only 8.5% positive of the infection. Recovery rate is about 69.82%, not counting the active cases which have recovered. This could be higher than what is being reported. Death rate as a percentage of total test is a low 0.14%. If mortality is based on population, death rate goes down considerably at 0.002%. In other words, the chances of not dying is 99.99%. Even when there are talks of mutation of the virus to a more infectious variant. People seem not scared. But here are some things people might not heard about in the news. Survivors, or those who have recovered from previous coronavirus epidemic, have been found to have suffered lung infections, high cholesterol levels and falling sick for as long as 12 years after it swept across Asia in 2003. These survivors had also been found to have become susceptible to inflammation, tumors and glucose and lipid metabolic disorders. There were also other long-term health effects such as developing acute respiratory disease syndrome or ARDS. Post-traumatic stress disorder or PTSD, anxiety and depression. The reality is that patients now suffering from the COVID-19 disease are overdriving their immune systems. Fighting off the virus has compounded the damage to other organs of the bodies. While researchers are only starting to track down the long-term health of survivors of COVID-19. Past experiences with similar coronavirus outbreaks show that the aftermath can last more than a decade. People should not be short-sighted during these trying times. Not only there is a decade-long aftermath on health of people, there is also a serious threat to humanity as a whole. As a pandemic continues its spread across the globe, it has taken lives, stirred anxiety, political drama, overwhelmed healthcare systems, and triggered potentially long-lasting geopolitical change across the world. We could now be facing the worst economical downturn in modern history since the Great Depression. Even worse, there could be 500 million people being pushed to extreme poverty, if a vaccine is not developed fast enough. What are we to do? As part of the human race and as ordinary citizens, there are small things we all can do to be part of this worldwide battle to defeat COVID-19. Start from your homes. They are your best refuge and first line of defense. Your default mode is to stay home unless there are extreme necessity to go out. These are some of the best practices of preventing a breach of the virus in your homes, and enjoy the freedom of family bonding without fear of infection. Practices self-hygiene by taking a bath as much as twice a day. Wash your hands with soap as often as you can. Better still, wash them with alcohol too. Take immune-boosting vitamins and food. Take enough sleep and avoid being too stressed out. If you have to go out of your home for essential errands, protect yourself with an approved face mask and face shield. Do not go to crowded places and confined rooms. Limit your time exposure to such places and do social distancing. When coming home, always take a bath and leave your clothes, shoes, or slippers outside your homes. If there are visiting non-members of your family, including relatives, ask them to wash their hands with soap, water, and alcohol before allowing them to go inside. Do not allow delivery personnel to enter your homes. Take the goods with caution and disinfect the packaging before touching them with your bare hands, and getting them inside your homes. If you have returned to work in your offices, shops, factories, and had to ride in public transports, make sure to practice the safety protocols as prescribed by your employers. Do the usual safety protocols when coming back to your homes as when you are coming from errand trip outside. Do not mingle with your co-employees and co-workers during break times. Go straight homes after working hours. Always report to your family members your whereabouts as a matter of daily practice. If you take safety protocols seriously in your homes and workplaces, more homes and workplaces will be COVID-free. In time, the virus will weaken as it will hosts to spread itself. Given the quarantine status of communities, people have more time at their homes. Safety at home reduces the time of the virus to spread. The key to defeating this pandemic and preserving our social and economic life is securing our homes and workplaces from the virus infection. Outside of these safe havens is a battleground. Do not bring the enemy in our homes and workplaces. If you have to battle it out outside your homes and offices like supermarkets, restaurants, riding public transportation, among other public places, carry with you the safety gears, and ensure you don't get hit by the virus. And lastly, pray to God the Almighty. Our combined team of risk managers and advisors from Philinsure, Risk Integrate Incorporated and ERM Phils cares for your safety, health, and well-being. You can call us for any assistance you may need. We have customized medical insurance coverage that we design based on sound risk data analytics. We also offer an automated health management system platform that allows you to monitor your utilization of benefits and manage your employee benefit costs much more efficiently without sacrificing the level of protections of your people. This Health Manager module of our integrated risk management system is a state-of-the-art platform equipped with artificial intelligence and predictive knowledge capability. For more engaging insights about risk managing, subscribe and follow us on this channel.